Hello, everyone. Good to see you guys again. Yeah, this is Weifeng and University of Wisconsin Madison, the teacher here. Today we have a guest student, our PGY2, excellent PGY2, rising rock star microsurgeon, uh, uh, Maddie. So Maddie, today's Maddie's third lesson. So we go over we practice twice about the basic technique, suturing and knot tying method, and how to stitching. And today we will use synthetic vessel to apply all the technique we learned from last two lessons. Yeah. Okay. Yeah, Maddie, tell our friends a little bit about you.
Yeah, hi everyone. I'm just started second year this past couple months, and yeah, very excited for my third lesson, and yeah, to actually be practicing on a synthetic vessel.
Yeah, great. Okay, let's get started. Turn this on. Yeah, you try turn this on so you can remember in the future how to.
Yes, with all the steps.
Yeah, keep turning it. So.
Oh, there.
Yeah.
Okay, I was
so
like,
yeah,
didn't fully go on.
yeah, that's a very special mechanism to start it. Can you see it clear?
Yes.
Oh, let's start by practice just tying some knots.
Yeah.
First. Okay. Go back to this one.
Mm-hmm.
Yeah. Okay, now you put the suture out. Yeah, and then release the tail first.
Oh, okay.
Yeah, release the tail first.
Oh,
That can avoid while we try to unwrap the suture and then break the suture from the needle.
okay.
Yeah. So release the suture, all the suture away from the sponge and
I
then
see.
gets a safer
Okay.
way. Yeah, you can put it under the microscope so you can see it.
Oh, I have it reverse. Oh, did I bend it now?
Yeah, no problem.
Oh
A little bit.
no. Already.
Yeah, dangling the needle. And then you try it. Oh, let's play some music.
Okay. There we are. I feel a little out of focus because I feel like I can't see.
Oh, so you adjust the microscope.
Yeah.
Yeah.
Let me.
Now in the lab, just
Oh wait.
try.
I also have this setting. Okay. Yeah. Okay. So let me adjust the focus.
Yeah. Did you check the eyepiece?
Yeah, I think, or I have contacts in, so it's on just neutral now.
Yeah.
I think that's better. Okay. So.
Yeah. So the ratio,
A little long.
2.5 to 3 times of the short end.
Okay.
Yeah.
Switch.
Yeah. Let's practice switch first.
Okay.
Then switch hand, so we don't need to cross our instrument. And train both our hand. Yeah. Pick up the tip. Yeah. Nice. Yeah, go that way. Tie a square knot. Another way, like this way.
Oh, I see.
Yeah. Yeah, nice. Yeah, that's a beautiful square knot.
Because of my bent needle, it's twisting.
Yeah, and then here.
Not perfectly straight.
Yeah. So the new suture is long.
Okay. So a little bit longer should go. Maybe.
Yeah. You can start by the needle holder holding the long end. So
Okay.
the first knot we don't need to cross our instrument.
Right, okay.
if you don't pass the suture, just keep going.
Okay, I felt like I did something wrong. Okay.
Go this way. This way. Up and around like that. Yeah, rest your hand on the table.
Okay, yeah, I'm kind of free floating. I didn't do the successful passing.
Let me show you some tips.
Yes.
Let go. I don't cut this suture. I just.
Okay.
Now come on. Microsurgery. The way we using the instrument is like we writing. Like we are writing like man. Like that, right? We use finger instead of
wrist.
moving like
Yeah,
that.
I do feel like I'm doing that. Okay.
Yeah, so I know at the beginning it's hard because you need to relax your hand so you can use your finger.
Yeah.
Yeah. So I want you to, when you're feeling it's so hard, try to find a way how you are writing. Yeah, think about using this instrument to just write your name like Madeline Chin. I am excellent.
Yeah.
Think about that way to use the instrument. The longest movement of microsurgery is pulling the suture way out. Other than that, all the movement is just like writing a very tiny name, just like 1 to 2 millimeter movement. Yeah. So think about how to use your pen.
Okay.
And then the ratio of the suture is important. At the beginning, like this one is
too long.
Yeah, like 5-6 millimeter. That's good. You can see this one it's already a little bit like 8-9 millimeter.
Right.
Yeah. So like this length is good.
Okay.
Because the long is making it harder. So and then we're holding it like 2.5 to 3 times the short end.
Right.
This way.
Yeah, it's more easy to handle.
Yeah, easy to handle. Like even make a surgeons now make 2 loops. And then when we pull the suture, pull it evenly so we can lay it out very good. So remember the first now we pass the suture.
Yeah.
We pass the suture so we don't have to close our instrument.
Okay.
And we don't need to think. And then we practice our left hand and right hand. So that's the purpose of we practice at the beginning. Use both hand tie knots. And when we make loops, we bring the suture very close to the here.
Okay.
So that's why you see I do it kind of very efficient. So I just make loop and then catch. And sometimes we make loops here and then we need to travel so far.
Yeah.
So that's making sometimes even the suture will fall out of the instruments. Yeah, so every time when we make loops, go here. So we make loop and then we catch it.
Yeah.
And then the second method is, if we didn't pass the suture, you just keep going. And the second one we don't cross, we just go up and down. Up and down can compensate the suture direction comparing to have to go all the way across. Yeah, most of the time you can see the teacher they just pulling it up and down instead of doing this way.
Right.
Okay. Have we practiced the airborne method before?
Yes, we did
A little bit,
before a little bit. Yes.
No worry, let's go. We can practice it while we doing anastomosis. So there's
Okay.
those are two things. One is bring the suture very close to the short end to make loops.
Okay.
That can make you be very efficient. And the second is kind of past the suture, so we don't need to close our instrument.
Okay.
That's why we close past the suture.
Yeah. Okay. I kind of forgot to pass the suture last time, so I want to do that again.
Come on. Let's try on big vessel, big suture. This technique is translated from our general practice. It's not a special one.
Yeah.
Okay, now you hand tie knot.
Hand tie, like two hand tie.
Yeah.
Okay.
Oh, yeah. Okay. Yeah. Good. Now the first one. Yeah. Try again. Yeah, lay flat. So in order to we have to cross our hand to lay it flat. So in order to not cross our hand, what would you like to do? What would you like to do?
You can do another of the same throw.
No, the first knot. Now this is a slip knot,
Yeah.
right?
Okay.
So what would you like to do?
Go the other way. Let me see. No, both of them are like that.
Yeah.
They're both
Okay.
two-handed.
That's a suture.
Oh.
Use the karate chop. Use the handgun first.
Okay.
Yeah, you can.
Cross suture.
Yeah. Handgun. See?
Yeah.
By cross the suture, we don't need to cross our hand.
Oh.
Yeah.
Oh my god, am I always doing that wrong then if you just start throwing without crossing the suture?
If you go to the OR, because now
Yeah.
because now when you in the rotation or you in the OR, they use a lot of the micro clip or clip to do the ligation.
Yeah.
If you go in my era, in my age, and when we go to the OR, press here. As when we are the medical student, we tie knots everywhere. You can see the student tie knots here. We tie knots on our water bottle, on our backpack, and use our shoelace everywhere. We just randomly pick up the suture and then we start to tie knots, like maybe karate chop or something. We don't really care of the flat knot, although the teacher told us. But when I was in the OR, what I saw the professor, he picked up the suture and then he naturally just crossed the suture and started tying knots. I realized they didn't teach us in the school, but they do it they cross the suture in the surgery. So like if they cross on the top, they just hang on, so they don't cross our hand. But in the textbook, even the textbook, the picture still kind of showing us, cross your hand to tie a flat knot. And when I go to the microsurgery, and I slowly I don't have understand, and then I didn't understand this practice and this practice, how we translate it. But actually slowly I figure out, that's why in the microsurgery we starting by our needle holder to holding the long end. That's because we don't want to cross our instrument.
I see. It's like crossing the hands.
And nobody tell us.
I've never even noticed that.
And
I feel like I don't think about it.
Yeah. And then even us, we don't realize we did that. Yeah, so that's slowly after I teaching, and then I understand there's something similar to what we are doing in the microsurgery and in the general practice. So like this, raise the edge, press down, move forward, pick it out, or pick it up. So now we make sure only the front one and the
Okay, yeah.
and then we move forward again. So here, don't just punch towards the vessel. Sometimes we just kind of just press it, or sometimes we grip the adventitia
Yeah.
and bring it towards the needle. So if we try to just moving the needle forward or tilting it up like that way, that's the cause of bending the needle. And then when we take the needle out, turn the needle holder. Don't holding the if we holding the needle holder like this way, before we close the arm, one arm already hit it away. So turn it, and then pick it up like that way. And if in a vessel, we want this part go straight through the vessel. We don't want to go this way. So there are two methods. One is we use our left hand because now it's on our left side. If we still use our right hand to go to the left, it's not comfortable. So after we take the needle out, we use our left hand to pull it to the left. And then our right hand is free to kind of adjust the tail or secure the vessel. That way, that's usually you see Dr. Paul his method. And if you still want to use your right hand and put your forceps here, making as a pulley to make sure this part is going straight.
Right.
Don't go this way. Yeah, because especially when we're walking on a small vessel, this bar is really tiny. If sometimes the tail get caught in somewhere and we still pulling it, that that force will rip the edge. Okay. So when we're pulling it all the way out, and then we bring it back to in front of us, while keeping it still in the air, I catch here. This way, and comparing to we go to the left and try to pick up on this side, the difference is the suture direction, orientation. Now this suture, we bring it back to here, is that the suture is pointing towards this side, making it hard to make roots.
Right.
But when we bring it back to here, and then the suture, this one is pointing towards here, this orientation is easier to make loops. And when we make loops, right above here. So bring it here, and like if we bring here and travel here, that's the why sometimes you see, the teacher or me doing kind of so easy. There's some small detail. There's some small detail.
You do make it look easy.
Yeah. But this detail, I don't realize it until I teach you guys, and I compare to the difference of you and me, and I realized that when I was at the beginning of my practice, it's also really difficult and hard. But then slowly I'm getting better. But I don't know what has been changed. Okay, put one here. It's kind of adding one in between. Think about how you use writing, holding a pen like writing, use your finger. Press down, move forward, pick up the front more and put it on the tip. Okay, nice.
A little angle. Use your left hand or just put a forceps here as a pulley. While it's still in the air, pick up the suture
So most of the time we should at least has one hand holding the suture.
Okay.
Yeah.
But I want to do it in here.
This is the traditional conventional method. We translate the stitching, the suturing the skin. Use make loops on a needle holder.
Okay.
Yeah. Make loops right above the short end.
Oh wait, I didn't get it square.
Yeah, that's the traditional method.
Oh, okay.
We cross our hand
So
instead.
I should.
Yeah, start by the needle holder.
Okay.
Yeah, bring
wait.
it back to in front of you. Yeah,
Okay.
this way you can make the suture direction better.
I see. Okay. I messed
Make
up.
loop right above here.
Okay.
Yeah. Yeah, two loop. First knot, two loop.
Oh, two loops. Yeah.
Certain knot. Yeah.
I see. Okay.
Yeah. Okay.
Okay. So then pass.
Yeah, nice. Yeah, make loops right above the short end. Yeah, keep going. Yeah. Yeah, pass the suture. Yeah, this. Yeah, I suggest we pass the suture and then practice both hands. Improve both our hands dexterity first.
Pass suture.
The sutures and
Probably a little.
correct yourself. share a post to the Facebook.
Everyone can see me struggling. I honestly feel like I took a break. I hadn't had a session in a while, and I wasn't practicing at home, so I feel like I kind of forgot a lot of the just like the steps of the hand movements and everything, of like which hand goes where. I feel like I'm very rusty.
Yeah, that happens.
Yeah, need to do more regular practice. That's a little long, I guess. Maybe do a little shorter.
You have a lot. You have in a lot of time.
Okay.
Yeah, because you won't use this one.
Am I doing this right? Okay, wait.
Try to start by the needle holder.
Okay. Oh, like closer.
Needle holder holding the long end.
Oh my
That's
gosh.
the that's
I
the way
always
of
keep. I always keep just.
yeah.
I
That's
don't know
the
why I keep doing. Okay, so the needle I'm holding with the needle holder.
yeah. That's the way we
Okay.
cross the suture, right?
Yeah. Yeah. Okay.
Yeah.
So needle holder. Oh wait, I forgot to do two.
Yeah. The first one, surgeon's knot.
Yeah.
Yeah. In the real anastomosis, when there's the tension, like the first and second stitch, use surgeon's knot. Keep your forceps close. That can make loops easier. Yeah, while we're making loops, close the forceps. Yeah, pass
So
the suture.
then pass the suture.
Yeah.
I probably left this tail a little long, huh?
No problem. Yeah.
Okay.
At the beginning, we cannot pay attention to everything,
Yeah.
but slowly,
Yeah.
it's kind of the theory, like the bandwidth. At the beginning, we use a lot of cognition power to pay attention to some small things, but slowly, as we practice more, it will become less and less, and then we can pay attention to a lot more small details.
Right.
Okay, let's go
Okay.
to the vessel.
Okay.
So for the anastomosis, there's two major methods.
Okay.
One method is two major methods. One is we do the front wall and then flip it, and then do the back wall. And then another method is do the back wall first. So there's two methods, and there's some different way to do it. So the very classic method is the two-step method. We start from the 12 o'clock and then 6 o'clock, and then add one more in between by dividing it to half, and then adding more stitch in between. And then if a bigger vessel, we just kind of dividing it to half. And if a smaller vessel, we can even it just put two stitch there. That's a 6-stitch style. And then we flip it to do the back row.
Okay.
So this method is the two-stay method. Two-stay, this suture, the first suture, that's a stay suture.
Yeah.
Because when there's a frame on the clamp, this suture can attach and stay on the frame. So that's why they name it as a two-stay suture, the senior professors. And then when there's a vessel, when the vessel is not long enough, there's too much tension, or here's that big branch holding the vessel, we cannot flip it, and then we have to do the back wall first.
Okay.
So the back wall first, there's two. The textbook method is the one-way arm method. We start from the away from you, and then go here, here, here. First stitch, second, 3, 4, and then kind of go all the way up to the top. After we finish these 3, that's almost the same. And then this is the median stitch, and then the front wall. So that's the only 3 stitch difference. That's the back wall first. One way up, one way up, so one way up, right? Yeah, and then Dr. Sieber, he has when we talking about this method, he said I start from the middle instead of starting from here. And then interesting, I tried this Dr. Sieber's method. It's actually easier than this one because like the second stitch, it's hiding very deep inside the corner.
Yeah.
And Dr. Sieber's method making the second stitch is close to outside, so it's easier to approach the second stitch. And this stitch on the other side, actually we just use regular method can can perform this one. So I try this method actually. Dr. Sieber's method is better. And when I talk about that, and some of my friends in China, they use this method right away. So this is actually a 2-way up. We don't have a name of that. Actually, yeah. So we may name it like a 2-way up method or backward middle first method. So
2-way up, yeah.
This method has some variation. Like they may start from like here and then go here and then kind of not go to the half. They go from like 1/3. So they have a slack on the other side. But I feel when it's the big vessel, it's not necessary. This method, by dividing it, making the vessel even, making the space even. Very convenient to make the space even. If we like doing this way, sometimes the suture is not even. Especially on the other side, sometimes it's like this longer and this shorter, and making there's a weaker point, making there's a spot of leaking. Yeah. So by dividing it, most of the time I use this method. But at the beginning, if it's hard to find the right lateral spot, we may go a little bit on the top. The principle is just to do the left stitch, by even the space. That's it.
Yeah.
If we go from here, it's hard to go here. We go here, just line up the stitch on the other side, go here, line up. Instead of here, go here, and then the exit by go to here. Just even the space and line up the suture, that's it.
Okay.
Take a needle.
Tail just keeps getting.
Okay, now you cut it.
Okay.
Cut it and then you fix it.
All right. Scissors.
Now let me demonstrate a little bit first. So now this is 2 mm vessel. Now it's 4. We can go a little bit higher magnification, like go to 5, 6, and then we can see better. Right? Are you in good focus now?
Yeah. Oh. Yeah.
Okay. Now I want you to adjust the microscope.
To zoom in or to
Zoom in.
okay.
Yeah, zoom in a little bit.
Let me see that.
Yeah. Zoom into you feel it's clear and good, comfortable.
Is this an okay? Or is it too?
What about you?
It looks okay to me.
Yeah, good.
Okay.
Yeah. Now you are the surgeon, so you make sure you adjust it to match your eye.
Okay.
Okay, so the first stitch is we put it here. We want to go from here, but now we can hold the needle a little bit, pointing our shoulder, and then we like that. See?
Yeah.
And then usually the first stitch I would like to use 2-step because usually most of the time there's a small space in between the proximal and distal end. When we try to reach to the distal end, sometimes we tear the proximal end on our needle. So here, see, I put one arm here to press it down, and then my needle just move forward.
Yeah.
Instead of just try turning it,
Yeah.
that's hard.
Right.
Use your left hand to help you. Now I use my left hand, pull it all the way to the left, and then I use my needle holder to secure the vessel. Because the first suture, the suture is completely free. So as we pulling the suture, the vessel will go with our suture.
Okay.
Yeah. It's a little bit bigger on this side. Yeah, that's fine. Okay, now we want to line up the vessel.
Yeah.
So we want to adjust a little bit so we can line up the edge very, very good.
Okay.
I think about if we have to close our instrument, you don't have the capacity to adjust the vessel anymore.
Right.
So practice method, practice our both hand tying knot first.
Yes.
Okay? Yeah, I'm going to cut the suture.
Oh yeah, let me go.
Oh, it's too out of the microscope camera. Okay. Yeah.
Oh, too long.
Yeah, use your left hand to support your
Okay.
scissor so you can cut it very accurately.
Oh, yeah.
Keep this long. Okay.
Oh, now too short.
No, it's fine.
Okay.
Yeah, how short it is? Keep that long end because I want you to help me, so I. Braid needle, braid the suture. That's a good reason to use a new suture.
Embedded in here. We can't get it. There.
This side is also, it's hard to pierce like that. So like we bring, see I use the needle to bring it. The first step is a little bit open we put open a little bit towards ourselves. So, and here's how to push into there. So I move a little bit on the top.
Okay.
So go to the open up. That's the forcep. And then on this side, if you use 2-step, when it's very close, we can use 1-step. We use 2-step, it's also good when there's a gap. Because when we try to reach out to the other side, sometimes it will tear the vessel here. That's a real mistake I made. That's why I learned from it. Now I want to go to the lateral medial side, so I pull in a little bit, use the needle, and I press it down. See? So that creates a difference for my needle to pierce. Now the needle is on my left side, so I use my left hand to pull it out. But sometimes the tail is stuck in somewhere, I use my needle holder to release it. Yeah, you can come out to see my hand. I rotate my wrist and then pulling it out. Yeah, try not to just raise your arm, because when we raise, we use our bicep. The bicep don't want to do micro. And this is the longest distance we need to move using a new suture.
Okay.
So certain slot. So now when it lie very good, then we tie it down. Yeah, cut one. Keep this one.
Oh, I'm sorry.
Yeah, no problem. Yeah. Okay, now this one is 2 millimeters, so we may add 2 more in between. That's it.
Okay.
Same method. Now we press down because we support it, and then the edge raise, and then we just move forward. And this one we press down and then move forward. So we can try a little bit smaller, try to line up to match the size. Yeah, how short is your cut? Yeah, 2. Yeah, yeah. I think this one will be good. Okay. Now the suture is kind of clinking here, so what I need to do is I bring my hand out, and then I come back, so the suture can stay on the outside.
Right.
Same method. Now it's your turn. We'll finish the back wall.
Okay.
So to the back wall, just flip it. you can check that no backward stitching. Okay.
Okay.
Yeah.
So I'm just gonna do.
Now you feel it's hard to pierce.
Yeah.
Because the needle is pointing up.
Okay.
So remember when we talk about the needle direction, there's two things. One is you want a needle pointing straight forward,
Yeah.
not up and down. And the second is the needle parallel to the axis of the vessel.
Right. Even more choked up on it?
Yeah, holding the suture, so dangling the needle.
Would you choke up more on it, or does this look okay?
Yeah, that's look okay.
Okay. Still feel like I'm having to. I'll do two stitch. I should probably do two.
Oh yeah, one.
Oh, just do one?
Yeah, just do one.
Okay.
Yeah, the first two we do one, do two. After that, because the vessel is already very close, so just do one.
Try to just grab the adventitious.
And you can just go back.
Okay.
Yeah, you know to try to get the adventitia, but this vessel is no adventitia. Just grab the
I
vessel.
see. Okay. So here we are. Oh, but I feel like I'm angled.
Yeah, so pre-holding the vessel, like give me the suture. So to make it line up the vessel easier is there are 2 points. One is we holding the needle parallel to the vessel.
Okay.
Like if we holding the needle like this way, the needle is perpendicular to the needle holder.
Yeah.
That's hard.
Yeah.
Because it's really hard to adjust when we stitching it.
Right.
So pre-holding the needle, we would like to kind of pivot a little bit, or we bring our hand to the middle a little bit to compensate the direction. So this way we can just do an in and out, in and out.
Yeah.
And then we can line up the
Yeah,
vessel.
it's parallel. Yeah.
Parallel to the axis.
Okay. That looks pretty parallel to me. I still feel like it's slightly angled.
Yeah, if you want, you can try it one more time.
Okay.
Yeah, because just practice to training our the muscle in our hand.
Yeah.
Yeah.
Okay.
Now you can hold on a little bit. Now the needle still pointing up a little bit.
A little bit more choked out.
Yeah, so you can hold on a little bit to the needle tip, so you can.
Even more than this?
No, it's good.
Okay. Oh gosh, I just moved it.
Yeah, you can turn your needle holder a little bit, like you're holding a needle a bit like that way, holding a needle holder like this way.
Oh.
More flat. Yeah.
I see. I see. Okay. Okay, so that looks parallel. Is that a little too close to the?
Yeah, it's bigger back. Yeah, nice.
Oh. better, but I still feel like it's not perfect.
So left
So
hand.
then left hand here. This supports it as a pulley. Just rotating back. Okay.
Yeah.
Then I will.
Bring it back in front of you.
I dropped it.
Oh.
Okay. Where am I? Back to in front of me. Okay. Then. Or maybe I'll hold a little bit further out.
Yeah. Maybe close your forcep. Yeah. Holding your forcep close. Yeah.
Closer to here.
Yeah. I mean close the forcep. This way we won't. It's easier to make loops.
Wait, what is it? Like this?
Yeah.
Okay, I see. Is that about the right
Yeah,
tightness? Okay. Then I'll pass.
Now because the forcep. Oh yeah. That makes sense, right?
Yeah, I see.
It's hard if you're holding the suture like that way.
Okay, pass again. This left hand is like always feels really unsteady, and I feel like I have no.
That happens. Yeah.
Okay.
Slowly, the dominant hand still better than the non-dominant hand.
Yeah. Okay. Alright. Let's come back. Be a little bit more choked up, and then also turn the needle this way. Let me turn right. I want it to. Okay, wait, I can't see myself. Okay, so then I need to kind of turn it this way because in order to keep it parallel when I turn more this way,
Yeah, this is the
then
best
I'm more like this.
orientation.
Okay.
Yeah.
Yeah,
If you cannot turn the patient, and then we have to move our hand.
I see. I feel like sometimes when I'm doing it too, like it kind of moves in and out of focus. I don't know if that's me moving my head, but like occasionally I feel like it will like be blurry.
You can lower the microscope a little bit, going down a little bit, because, right? Is that better?
Yeah.
Oh. Because the depth that's like in this magnification, the depth may be still pretty big, like almost 2 centimeters.
appropriate tightness.
Okay. Yeah, nice. In the teaching, I realize you don't need to correct every step. You just focus on one or two things at a time, and then slowly you just go to the right way.
Right.
Yeah, like it's kind of doing, oh, no worry.
That's
the
like
same like
50 things could
that's like
adjust.
like our kids, like you're
Yeah.
doing, oh, you're doing here and there, can be better here and there. You try to point out everything.
Right.
That's too horrible.
Yeah. Yeah.
You're making the kids is not want to talk to you.
Right.
Talk to me. And there's a study in elementary school teaching. That study is kind of they test the kids. They teach one thing at a time, two things at a time, and three things at a time. And they compare how fast they move forward and
Right.
how good they can maintain. So actually, teaching two things at a time, that's the best. They
That's
can,
the most we can handle.
yeah, most efficient. They can remember things better, and they can learn faster also. And the worst thing is to learn to teach three things at a time.
Right.
One thing at a time, that's a little bit slow because actually our brain can handle a little bit more than that.
Right.
Mm.
Can progress along a little faster.
Yeah.
So I should start furthest from me.
Yeah. Holding the needle a little bit towards your shoulder. Yeah, holding the needle holder
like this.
Yeah,
But then, so for now, I should just adjust the vessel to be in the same orientation as my needle, or should I like move my hand then to
yeah.
be?
Your hand.
Okay, yeah.
Holding the needle towards your shoulder, that's easier to pierce the vessel.
Okay,
And
okay.
then put your arm, yeah, put the forceps inside the movement.
But I want to kind of come back as far as I can. Uh-oh, I feel like I'm losing my needle.
And you're holding a little bit shorter so you can control the needle better.
Oh gosh.
Yeah, holding a little bit higher. Yeah, so actually, like at my first trade practice, I just practice pick up the needle at home
Yeah.
until I feel comfortable picking it up and adjust it to the right direction.
Right. Okay, that's what I need to study at home. Okay. So, a little bit more this way. Move my hand so it's. Okay, I can't see very well. I feel like I need to move it more to the center. Okay, needle facing towards my shoulder.
Yeah,
Okay, oh, let me do two.
yeah, two step. Two step is kind of make sure we got the entry by, so we won't lose it
Right.
while we try to reach out to the distal end.
Okay. So then
is now still pulling up a little bit, so it's hard to go pierce to the
okay.
side.
Maybe more. Oh. That's too much.
And pulling out a little bit longer so you can
Okay.
adjust it easier.
See, then I get blurry. Okay.
Oh, if you bury, adjust the microscope.
Yeah, well, I feel like I'm just moving my head because then the. I don't know. Wait, maybe let me see. No. Okay. That seems better. Okay. So then. I guess I'm having a hard time exactly lining up like where I will perfectly be. It's like about here.
To that low. Yeah, pretty good. Yeah.
Okay, so then I'll pass here. Then I'll
Yeah.
go.
Yeah, good.
Okay, oh, wow. Oh, I see what I was doing there.
Yeah.
Okay, so now I come on my side, but the needle's still looks
Yeah.
a little up. That's a little better.
Force that in the movement. Yeah, and then
To go as low as I can.
yeah.
Okay.
Yeah, so you pierce.
About here.
Yeah, if that's the if just as far as you can to the left, to the medial
Okay.
side.
Try to go even more.
Yeah.
Okay.
Yeah. And then on the other side, line up the exit bite, the
Okay.
entry bite.
I'm going to grab. Oh God, I was pulling a little aggressively there.
Okay. You don't need to pull all the way out.
Oh right.
Yeah. So.
Okay. And then for this one. I don't know if that's actually.
Well, then we get into the loop.
Oh, I see.
Yeah.
Oh,
Yeah.
that's not too bad.
in here it's a little bit small.
Oh yeah, I see that.
Yeah, because this is hard for you at this time. Slowly you will getting better.
Yeah.
Mm.
I feel like I pulled the tail longer. Oops.
Yeah, good.
Okay. Slowly but surely. Okay. That's just because I want to get out of the way. Okay. So then you go for the one further from you or the one first? Okay. Make it a little more parallel.
Yeah, nice.
No, a little more.
You get caught on the edge a little bit just
Okay.
now.
Do I just...
No, it's good.
Okay.
Yeah,
That about good?
yeah, very good. Very good, this one.
Uh-oh.
Another microscope a little bit.
Thank you. Okay. Back in front of me.
Yeah, close your needle holder.
Oh, yeah.
now here, now how sure we can cut the suture is not, the standard is not interfere our next stitch. So when
I see.
yeah, okay, that's the right.
Right amount.
Okay, good. Yeah, very good.
It's kind of angled.
Yeah, try again.
Yeah.
One. Yeah, because now it's treating the muscle of our hand.
Nope, that was even worse.
Yeah, good.
Okay.
Yeah. Now you naturally bring the suture back to in front of
Yeah.
you. Yeah, that makes everything go naturally in the right way. The
Right.
suture orientation and then let's move the. Now it's hard because a little tip putting up, so making it. when you're putting up, you need to adjust a lot to do the pierce. So that's the cause of feeling difficult.
Does this look better?
Yeah.
Okay. Oh, but now I feel like I'm angled. Okay. Okay.
Yeah.
Does that look okay, or does it look like a little bit big of
It's
bites?
good.
Okay.
Oh, you said the bite is a little bit big.
Yeah. That's what I was going for. Okay.
Yeah, that's true. A little bit smaller, just tiny little bit, that you feel better.
Okay.
Yeah. The theoretically is we want the bite size is kind of twice of the thickness of the vessel wall. But most of the time we just design by the experience.
Right.
It's hard to tell. Even we adjust it just a slightly difference. Bigger bite, the good thing is you can holding the blood inside better. This one.
Well.
Yeah, this is your first one.
Probably
First
this is a little bit
anastomosis.
more spaced out compared to this one I see.
Yeah, so in
Probably
this
just-
situation, if we want to fix it,
Yeah.
we may use advanced stitch there, because
Yeah.
if this is artery, here we may be a leaking spot
Yeah.
because the artery pressure is a little bit higher.
Yeah.
Sometimes in order to doing it easier, we use 11-0 suture. So we just put once. Yes, try this one
Okay.
and use a small suture and then just kind of add one stitch there. Yeah, sometimes you don't have to put it in the lumen, just do it
Just
pierce.
go.
Yeah, because sometimes here the blood already fill it up.
Yeah.
That one is running to the edge.
Adventitia.
Yeah. Yeah, you need to press down a little bit.
Okay. Let me readjust. Okay. Shorter than I anticipated.
Yeah, holding a little bit longer, it's a bit easier.
Okay.
Surgeon's knot.
Did I lose? I lost it.
This
Okay.
synthetic vessel, we need to tie surgeon's knot.
Yeah.
Real vessel, yeah, if there's low tension, the regular knot is good.
Okay. Let me make it longer. Okay.
Yeah, 24 seconds. Yeah, in that situation, let me show you how we can do it. If we tie a knot that cannot secure, and then the second knot we just tie a slip knot. Slip knot can tighten the first knot. First one, second one we just use one arm as a pulley to kind of bring it down. Slip knot, slide down to secure the first one, like that. This one is, and then the second one, use, see, I use this one as a center and then pulling this one down. This is slip knot. This is a kind of intentionally tie a slip knot to tighten the first knot.
Right.
Then it's getting loose. Okay. You can test a little bit.
Okay.
Oh, didn't fit in there.
Some leakage.
But this is fine. I think it's because the distal is got clamped close, so it didn't flow through. At this size of vessel, like this space of the suture is totally fine. It won't has a big significant leaking. At the beginning it will leak, but when we press on it, and then the leak will stop by itself. Come on and try one more. Yeah, let's fix the needle a little bit. The needle is now is a little bit like close to the half circumference.
Oh yeah.
Yeah, bend the needle a little bit back to like 3/8 circumference. Okay?
Yeah.
Okay. Yeah. Half circumference is hard. Like we suture the tendon, sometimes we use half circumference. Most of the time, 3/8 is more convenient.
Right. Okay. Yeah, that does seem much better. Okay. So in this first one, kind of pointing towards the shoulder.
Yeah.
Getting back as far as I can.
Yeah. The lateral. Go to the lateral as far as we can.
That'll do it too.
I can see you pick up a little better,
Yeah.
easier.
Is that gonna be lined up though? Okay. That seems sort of okay.
Yeah.
Okay. Alright.
Yeah, good. Yeah, you have that sense that
Now
it's
I
already
feel it.
into your brain.
I need to just practice more frequently so I don't forget.
Forget is the way of learning.
Yeah.
Yeah, we forgot and then we picking it up again.
Relearning.
Yeah, so
Alright then, as inferior as I can go. Oh, let me take it too. Does that bite look too small or does it look okay?
it's okay.
Okay. Is that?
Yeah,
That seems okay.
yeah. You want to try again?
Okay.
Yeah, or we can just
Does
keep
it look
going.
like it's too
Yeah, this bite is a little bit big.
big?
Yeah.
Okay.
Mm.
Yes. I will try again.
Everything is about your hand control. Now,
Right.
yeah, so
Which I don't have a
every
lot of.
struggle under the microscope will contribute to your success. Yeah.
I feel like it's angled this way. Still maybe that's probably still a little angled.
It's fine.
That's fine.
It's
Okay.
Yeah.
Okay. Oh wait.
Yeah.
Yeah. But it doesn't seem like it was inferior enough.
Yeah, but that's fine.
Okay.
So we just even the suture after that.
Okay.
Yeah, like this one maybe just one.
Yeah.
And then maybe three on the other side.
Okay, I see.
Yeah, At the beginning, it's hard to go to the right lateral or medial. But there's a method like this. Yeah, shorter on this side and then more on the other side. That creates some slack on the other side.
Okay. Do you think I have enough for another one?
Yeah, maybe
Suture?
one more.
Okay.
One more.
Try to do the one in the middle then.
Yeah. Good.
I feel like it still came in at an angle.
Yeah, you can.
Let me redo it.
Yeah. In the lab, we just practice.
Yeah. Is that a little too big?
It's fine. This
It's
one
fine?
is good.
Okay.
Yeah. But yeah.
My last one was kind of short. Still a little angled, but
yeah, you will do it better next one. Yeah. It's acceptable. It's hard. Like if you tie a knot and then just tie a little bit towards me a little bit, that will be fine. Now it's like a little bit like this side a little bit longer, the other side is a little bit shorter. And the forceps may look that will be easier because forceps is smaller than the needle hole. Yeah, tie towards me a little bit. Yeah, close me a little bit. Yeah. Yeah. Before we tie it down, that's the one more chance we can adjust the suture. Yeah, keep going. Yeah, because now it's short.
So then now should I go this way?
Yeah, still go this way. Bring it towards the very close to the short end.
Okay.
Keep your forceps close. Close your forceps.
Okay.
Yeah, up and down. Yeah. Okay. Good. Yeah, you can hold in the needle so you can get a little bit longer on the suture.
Right.
Yeah, now you can see your limit is less than 1 centimeter. See how short it is? And the suture is about, what's that? Yeah, about 6 millimeter. Okay?
Right.
So next time when you still want to have 1 centimeter, don't give up. Your limit is
still left.
Okay.
Okay, so first I'm going to do the suture. Did you do this under the microscope? Do you grab it? Okay. Oh,
suture.
lost it.
Okay, a little bit. Okay. Yeah, we don't want the add the vessel very close to each other. That can make it overlap. Cannot see the lumen.
Yeah.
Yeah.
Okay.
Yeah, now we
So
put three.
thirds would be like
Yeah, one in the
here,
middle.
here. Okay.
Yeah,
Yeah.
that's
Start with
in
the middle. Okay.
Yeah,
That makes sense.
yeah. That's easier. But
Right.
dividing it is it's always easier than. Good, good job. Yeah. Now you
Total
can feel
funky.
you feel it's hard when
Yeah.
the suture the needle already on the needle on the vessel and then adjust the direction. It's
Right. Okay. No.
the eyes.
Needles. My needle. No. Still like it.
You want to go towards the knee a little bit.
Yeah.
This one's better.
Okay. Oh, but I went. Oh, harrowing.
Maddie, now I want you to feel that's the difference. If we dividing it in half and just equally half instead of like this one, the upper part, the front wall is shorter and then the back wall is longer. So by doing that, the disadvantage is like in here it's a little bit hard to do.
Yeah.
Yeah.
It's kind of hard
Yeah,
to.
comparing to be just dividing to half.
Yeah.
So the second stitch. So I slowly I know this method they talk about doing it not in half but 1/3, and then leaving 2/3 on the back wall to create a slab on the posterior side. But slowly I don't do that because I
Yeah.
feel it's hard to adjust.
Right.
Hey.
Oh, wait a minute. I feel like I didn't tie my first knot tight enough, but alas.
Hey, Christine.
Hi, Christine.
Who helped you to get access to the lab?
Alyssa?
Alisa?
Yeah.
Okay.
Oh, I'll contact her.
Years ago, yeah.
Yeah.
I'll ask Alyssa.
Yeah, you guys, everyone should get access to here.
Oh, sorry.
Okay, one more here.
Getting very blurry. Can't. Okay, gotten very blurry. Let me
Okay.
adjust. Okay, I think it was just because of this side. Okay. Alright.
Yeah.
I probably could have gone a slight closer to me,
Yeah, a little bit.
but I'll just do.
Yeah, slightly different.
Play it more towards me. If I will. Thank you. Let me re-grab that. Oh, sorry.
Yeah, great.
A little bit of struggle bus, but
It's your
I
first
made
time.
it.
It's your first time.
All right.
Yeah, Sophie.
Yes. Thank you so much. Weifeng.
Yeah, I should make a small video of why we tie suture. Forgot.
It's okay. The YouTube audience is spared.
Yeah, let's go to the YouTube channel and then.
Okay. Let's leave everything here.
Hi everyone. Yeah, so we wrap up the training session. Now it's 2 hour session, but we never feel that's 2 hour. Yeah. So we practice. We went over the basic technique, suturing and knot tying. Yeah, exactly. Now, at the beginning it's a little bit rusty, but then Maddie pick it up quickly. So that's a little bit different when you picking it up comparing to learn it from the very beginning. So picking it up after you practice, you get it. that's faster than the beginning. You learn it from zero. So practice anytime, and then if you build up your skills slowly. And then we go out, and then we went to anastomosis, and Maddie did two completely end-to-end with two-stage suture method. Yeah, which is great. Okay, next time we will go to a real vessel, chicken thigh model. Yeah, Maddie, share to our friends a little bit like one or two things in your mind you feel is helpful today.
I think today, focusing on what you were saying about trying to think about just moving the fingers as writing with a pencil. I still have a lot to go with that, but I feel like just mentally thinking about that was helpful rather than I feel like my automatic at the beginning was still moving my wrist. And then also, I think for the anastomosis, really thinking about not only just having the needle parallel, but having the actual needle tip go in straight rather than when it's pointing up was something I was trying to correct when I was doing.
Yeah, that's two good point. Yeah, yeah, being some small detail is really helpful, and that small detail sometimes you need a teacher to pointing it out, because like for me when we were at the practice at the beginning, there's a lot of small detail we didn't understand and then struggle a lot until we go to a better way, but we don't know what has been changed. And then when I teach, I observe closely the resident how they do, and then comparing to what I am doing, and then I know there's some small difference and very helpful. Okay, yeah, bye. Please subscribe and share.